Many have forecast that this week, South Korea will reach the peak of the Omicron wave. And we did indeed see record-breaking figures over the past couple of days. Now, with the surge, more than 2 million people are currently recovering at home. Our Choi Min-jung tells us how they are being treated.
Some people say that Omicron is not something you avoid. It's something you just wait your turn for. And my turn has already come. I contracted COVID-19 and spent 7 days isolating and recovering at home. And I wanted to share with you what hundreds of thousands of people who are infected are going through. South Korea has long been bracing for the worst of the Omicron wave to hit the country. And now it has arrived, with cases hitting as high as 621,000 a day. As of Friday, there are over 2 million people recovering from COVID-19 at home. The majority are people under 60 years old and those who are at relatively lower risk of developing severe symptoms. With the overwhelming number of people getting infected, health authorities have decided to simplify the testing procedure.
Before, even if I got the COVID positive result in the rapid antigen test, I would have to wait until the next day for the PCR test and another day for the result to come out. And also, waiting in line for the PCR test is another great obstacle. If I recollect, it usually takes 2 to 3 hours to wait in line. And there are also similar patients standing around you coughing. And if the weather is cold, you can imagine the frustration as well.
To minimize such inconvenience, health authorities have decided to accept rapid antigen test results conducted by medical professionals at local hospitals or clinics for official purposes, meaning their results will have the same validity as PCR tests. After testing positive at a local hospital, I was prescribed with 3 days of flu medication as I was not eligible for Paxlovid. I was then required to take an online epidemiological survey conducted by the Korea Disease Control and Prevention Agency. After filling in my personal information, including my name, personal identification number, and gender, I was also required to input information about my symptoms, as well as my family members who are currently living in the same house. Once the survey was completed, the Seoul Metropolitan Government provided guidelines on the different types of services people can make use of while they recover. And those who need to get medication due to worsening symptoms can consult a doctor by calling a nearby hospital or clinic or a 24-hour emergency hotline.
증상은 언제부터 있었어요?
토요일 오후요.
토요일 오후. 증상은 어떤 증상 있어요?
지금은 기침이랑 목이랑 코 쪽에 아픈 거는 계속 있었고요, 토요일부터.
네.
근데 오늘부터 머리가 계속 어지러워가지고.
상태로 접수해서 저희가 약국 팩스로 전달해 드릴 거예요.
네.
소방전 팩스로 전달해 드리면 약국 어디로 갔는지 문자 드리거든요. 그 약국으로 전화해서 약 준비됐는지 확인하고 다른 분이 대리 수령해서 전달 받으시면 될 것 같아요.
In just a few hours, the medicine arrived. And after getting some good rest during the 7-day quarantine, I was able to return to normal life without additional COVID-19 testing. After I was released from quarantine, many questions came to mind. Like, is it really safe for me to be outside just after 7 days? And does still having some slight symptoms like a cough mean I could still be infectious? To clear things up for the hundreds and thousands of people out there who are infected, I'm at a hospital to talk with a medical expert.
확진자가 7일 격리 이후에 일상으로 회복을 하는데 이게 7일이 충분한가요? 안전할까요?
The virus peaks between 3 and 5 days after symptoms appear. However, a very small amount of the virus may still remain after a week or two. And 40% of the people who get tested after quarantine still show a positive test result from rapid antigen tests. So even if a week has passed, people should be wearing masks and avoid meeting others for another week.
격리가 해제된 이후에도 증상, 기침 같은 증상이 오래 남을 수가 있는데 이것도 혹시 일상 회복에 조금 안전할까요?
Even if symptoms like a cough or muscle pain remain after 2 weeks, there's almost no chance of spreading the virus to others. But if the symptoms do last for more than 2 weeks, it is recommended to see a doctor and, if necessary, undergo treatment.
Many are also curious to know whether it is possible for people to catch COVID-19 again after contracting it the first time.
Studies have shown that people who have been infected with Delta have an around 56% chance of being protected against Omicron. But we can say there's almost no chance for people once infected with Omicron to get infected with it again. If you look abroad, the number of cases begins to decline once 25 to 30% of the total population becomes infected. This means that once infected, you cannot be reinfected because you already have immunity.
Now that we have the facts, it's relieving to know that people who have been infected with Omicron are very unlikely to be infected again. But for many, the COVID-19 experience can be traumatic. And to get help, people are turning to post-COVID psychological counseling provided by the Health Ministry.
The National Center for Mental Health sends a text message to everyone who has been infected and provides them with hotline numbers or links to a website. People who wish to get counseling, regardless of how severe their COVID-19 symptoms are, can get help anytime. And those who are considered at higher risk are managed more intensively. As a once infected person, I talked to the director to ask for some psychological advice.
8 in 10 people worry that they have caused inconvenience to others. And 7 in 10 people worry over what others will think of them when they get infected. So a lot of people go through the same concerns, and knowing that I'm not the only one having these thoughts is very important for people's mental health. People may feel psychologically weaker for a moment, but we keep providing ways for them to overcome their struggles.
The country's total number of COVID-19 cases has surpassed the 8 million mark, but health authorities and medical experts say that when given proper medication, COVID-19 could eventually be treated like the flu. Choi Min-jung, Arirang News.